Hello, everyone, and welcome to another round of our Health Reform Beyond the Basics webinar series. This is Hallie Cloud, and thank you for joining us today. For those of you who are new to our webinar series, this is a project of the Center on Budget and Policy Priorities, which is a nonprofit policy think tank in DC. This series is designed to help advocates, assisters, state and local officials, and others assist people access and understand the Affordable Care Act's health coverage options. It is intended for those working on the implementation of health reform and is not intended for press purposes. Today's webinar, the last in a four-part series on key elements of eligibility and enrollment, will explain who can qualify for an exemption from the individual shared responsibility payment, and will cover how to calculate the penalty for people who don't maintain health coverage or qualify for an exemption. Now, to guide us through today's topic, please welcome Tara Straw, a Senior Health Policy Analyst here at the Center. Take it away, Tara.
Thanks, Hallie. So today we're going to take a little pause on the enrollment information we've been sharing for a topic that comes up often unexpectedly when you're talking with clients, and that's, what if I don't enroll? After you've been sitting with someone for a long time, you're really struggling, they're really struggling, maybe the premiums aren't what they hoped for or expected. You can get to a place in the conversation where the question is, okay, but what if I just don't do this? And so this webinar is to help you prepare for that part of the conversation, should you face it. So first we're going to talk about the shared responsibility payment. This is the penalty. I also call this why exemptions are important, because the penalty is stiff. And it's something that people need to be aware of. People may not be aware of, especially with all of the discussion in the news and on Capitol Hill about repeal and replace. People may not be aware of what is the status of this thing, and so you may need to inform people of that. The individual shared responsibility payment is paid by everyone in the household who does not have minimum essential coverage or an exemption from the coverage requirement. So, and we're going to talk more about exemptions as well. It's calculated in one of two ways. It's the greater of either a flat payment amount or a percentage of income over the tax filing threshold. So that gets very mathy, but we're going to work through some examples that can give you an idea of how steep this payment can get for people. And you can see the flat amount is for 2017, so for people who did not enroll in coverage this year, the flat amount that people can expect to pay on their taxes in the spring is $695 per adult, or half that amount for kids. That flat amount can grow each year by cost of living adjustment. We know for 2017 this one is locked in. For 2018 it may be higher. So in the enrollment conversations you're having with people, you can prepare them for the fact that, well, this year the flat amount is $695 and it could be higher next year. It's a little harder to talk about the 2.5% of household income, although it comes into play for many people. It's harder to do the math in your head. But here's what it looks like. For a single person, no kids, you can see that for people up to an income of $10,400, there is no penalty. That's because there are exemptions that will cover that person up to that amount. And then there's a real sharp increase where there is no penalty, or where there is no exemption that is sort of broad-based. And that penalty amount is going to jump up to $695, and that will be the amount people will pay until they get about to income around $38,000. And then, since we're looking at the greater of one of these two things, at that point the greater of is going to be the 2.5% of income above the filing threshold. So you can see that, again, the amount that someone would pay in penalty increases. So let's look at another example. We've got an example, John. John has income of $17,000 and he is single. He's the only adult in the home and he was uninsured for the entire year. His tax filing threshold for 2017 is $10,400. So if he has income of that amount, that means he needs to file a tax return. So let's do the penalty both ways and see which way it makes sense for John. The first way, we'll subtract out the filing threshold, the $10,400 from his income, and then we'll take 2% of that amount, and his penalty calculated that way would be $165. Or we calculate it the other way, the $695 penalty for an adult without coverage, and we take the greater of those two amounts, which is clearly the $695. So that would be John's penalty for 2017. Now, what if he was uninsured for only 7 months? Well, in that case, we would take a fraction of the results earlier. So we would figure out what the monthly penalty would be and then multiply it by 7 to figure out what the final penalty would be. It's a little more complicated when you're talking about a whole family. Here we have the Ruiz family. The income is almost $40,000. It's a couple that's married filing jointly with 2 kids. We're going to assume that everyone is uninsured. And the tax filing threshold here is $20,800. So we're going to subtract out that amount from the income to figure out what is the amount of income they have above the tax filing threshold, multiply that by 2.5% to get 468, and then we'll calculate it the other way. So if we take the amount, the flat amount for each adult and the flat amount for each kid, you get $2,085, and that is going to be the penalty for this family. So you can see it's a really steep penalty these days, and so it's really important to think about this in advance, to think about it before people sort of throw their hands up and walk out the door, to remind people, because you don't want them surprised by this, and it's also potentially a hook. It's supposed to be a hook to get people to enroll. Now let's change the scenario a little bit and say that instead of everyone in the household being uninsured, we've only got one person insured. Let's say dad is the only one who is uninsured. Everyone else has coverage. But dad doesn't have insurance, and so we're trying to figure out, okay, so how do we help? So what would the penalty be for dad? Well, the first calculation with the 2.5%, that is going to remain the same. That is not based on the number of people in the household who are uninsured. It's just a flat percentage of income above the filing threshold. What does change is the second penalty, which is the flat dollar amount, because that is going to look at only the people who are uninsured in the household. So in this case, they pay a much lower penalty, but it's calculated differently because of the insurance mix in the family. Okay, so that's all we have to say about the shared responsibility payment. Just know that it's big, it's really consequential for people on their tax return. People will have questions about it, whether it still exists, whether, how much it is, and, if you can give them some rough estimates that really make people understand that it is worth their time to figure out how to get enrolled. Now let's move on to talk about exemptions. Exemptions are the ability to get out of paying that shared responsibility payment even though you didn't have coverage. So these are the sort of statutorily defined good cause exemptions for not having health insurance. And these will always be claimed on the tax return, Form 8965. It gets attached to your 1040 when you file your tax return, and you can claim different kinds of exemptions for different people for different months. The first part of the form talks about or is for the exemptions that are granted by the marketplace, and we'll talk more about those. These are for exemptions that you've already applied for or you're applying for at the moment. and you're doing this through the marketplace, you'll need supporting documentation for a lot of those exemptions, and you need to know that it takes some time to process. The other sections of the form are for exemptions granted by the IRS. These are forms that are claimed at tax time without any supporting documentation necessary to include with the form, and they're granted, automatically via the return. There's nothing else you need to fill out, no other forms, no other application to claim. So here's in more detail, here are the exemptions that are available. We have on the left all those exemptions that are granted by the IRS, and that includes the exemption for insurance that is unaffordable. We're going to go back and forth a little bit between 2017 and 2018 figures. For 2018, insurance is unaffordable if it costs more than 8.05% of actual household income. For 2017, that number was actually higher. It was 8.16%. So, so that's a difference next year. There's an exemption for people who have just very short gaps in coverage. They had gaps of less than 3 months, maybe some kind of transitional gap between, a job moving onto the marketplace or vice versa. Citizens living abroad, certain non-citizens. This includes undocumented immigrants. Members of healthcare sharing ministries, members of Indian tribes, incarceration, a resident of a state that did not expand Medicaid. This is, of course, the most popular one. Moving on to exemptions granted by the marketplace, there's another kind of exemption that you can get from the marketplace for coverage that is unaffordable, and we're going to talk in more detail about that because I think it's a really good option for some people that you may encounter. There's also an exemption for people who have a conscientious objection, religious objection to getting health insurance, and then there's a whole list of hardship exemptions. This can include, many of these people will fall into other kinds of exemptions, but this includes a variety of personal hardships, life hardships, homelessness, eviction, getting a utility shut-off notice, domestic violence. You can go through that list, and people have encountered some really serious life events. They're often covered here, and there's an option to file as other hardship in obtaining coverage. And we have some links here that you can look at as these. We have links to the marketplace applications for these exemptions. There's a separate application for each exemption. There's a hardship exemption application. It applies to all states except Connecticut. Connecticut is the only state-based marketplace that processes its own exemption forms. So if you're a Connecticut resident, then make sure that you follow the links for the Connecticut forms. There's also, affordability has 2 different exemption forms, one for the FFM and one for state-based marketplaces. This is an illustrative example of why marketplace exemptions matter and why I know it's a very short open enrollment season, but even before the start of the year, this is why you should care about sort of lining people up for potential exemptions. This is David. He lives in Texas, which is a non-expansion state. He lost his job in December 2016, and last January he asked about enrolling in health coverage for 2017. So last open enrollment, David came to you and he said, I don't qualify for any unemployment benefits right now. I don't have any income. I have no idea how much money I'm going to make this year because I don't have a job right now. I hope I get one soon, but I don't have a job right now. I don't know how much money I'm going to make. Because of all the problems and not being able to be specific on the application, he decided to wait. He said he's going to get insurance later. He's going to figure it out later. And his sister told him, well, there are exemptions that are available. Look, you're in the Medicaid coverage gap. You have low income, so insurance might be unaffordable. So the sister kind of set him up to believe that he could get certain exemptions, and so he wasn't so worried anymore about getting enrolled in coverage. In May, he gets a job. He earns almost $18,000 for the remainder of the year. He was uninsured the whole time though. And at tax time, he finds out that he didn't qualify for any exemptions because his income was above the filing threshold. He had, based on year-end income, his insurance was affordable, and that is a year-long calculation. It doesn't matter that he had some months where he had no income. That doesn't grant an exemption. His income is greater than 138% of the federal poverty line, which means he doesn't qualify for the coverage gap exemption, and no other exemption applies. And so on his 2017 taxes, he will owe a $695 penalty. And this really could have been avoided had some steps been taken earlier while he was still in that point of confusion about his income, while he appeared to qualify for those exemptions. More could have been done to lock those in. So David didn't get to the end of the year and find out that he was in a bad spot and was going to owe a penalty for the entire year. Assisters can be helpful on exemptions that can be forfeited if the consumer's situation changes over the course of the year. So people who are in a temporary job loss, who are temporarily have reduced income, if they qualify for the Medicaid coverage gap or the affordability exemptions, you can lock those in early by applying for a marketplace exemption. And you can also help people, though there's less time sensitivity on this. You can help people claim other kinds of exemptions through the marketplace, like for hardships or religious conscience. Let's talk more about the Medicaid coverage gap exemption and who it's going to apply for. This exemption is for people who are ineligible for Medicaid based on the state decision not to expand, so they're in the coverage gap. It applies to people who have income up to 138% of the poverty line, even though some of those people may be eligible for premium tax credits, people over 100%. And people can get this exemption for the entire year. Now, sometimes this exemption is going to be automatic. So if you submit an application via healthcare.gov and you're determined or assessed to be ineligible for Medicaid due to the state's decision not to expand, and if you have income below the poverty line, the forms will spit out an exemption code for you, and someone can put that on their tax return and they'll be fine. Where it doesn't work as well is one, where people don't know that there is an exemption code that was spit out for them, and so don't use it. But you may also need to apply for an exemption, so take an extra step and submit an application for this exemption if you're technically eligible for the exemption, but you had income between 100 and 138% of the poverty line, because healthcare.gov is going to sort of throw you in the premium tax credit basket and not assume that you want an exemption. Or if you are receiving a determination directly from your state Medicaid office, in that case, healthcare.gov is not going to know that you qualify for an exemption, and so you still need to take that extra step to apply for an exemption. So here's another example. This is Jane, and Jane is unemployed until she gets a job that offers employer-sponsored coverage. She has, at that point, she has monthly income of $2,200. And that puts her for the year at about $17,600, which is about 150% of the poverty line. And she's in Texas because we love to pick on Texas. So in this scenario, Jane applies for coverage through the marketplace during let's say during open enrollment. She applies for coverage and she's denied because she's in the coverage gap. She has some options here. She can get a marketplace exemption, and that would she would automatically get an exemption for the year because she had applied for Medicaid and received a denial. So her marketplace paperwork is going to spit out a code that she can put on her tax return. She doesn't need to fill out a marketplace application in order to get the exemption. And it's good that she has that code, because she can't claim this exemption directly on the tax return. without it. Why? Because their income is over 138% of the poverty line. So it matters whether we're looking at this prospectively in the marketplace application process or retrospectively based on actual income in the IRS process. If we're just looking at it retrospectively, then the IRS's position is going to be, you know, you have income over 138%. They're not going to look at months where you didn't have any income and grant an exemption for those particular months. Okay, so that's why it's important for Jane to fill out an application. If Jane did not apply for coverage in 2017, let's say she's a smarty pants. She knew she was in the coverage gap. She knew there was nothing that she could get out of open enrollment, so she didn't even bother to apply. Well, in that case, she's not going to be able to get a marketplace exemption because she didn't apply for Medicaid while she was uninsured, and she won't be able to get an IRS exemption because she has income over 138% of the federal poverty line. So Jane is going to have to pay a penalty because she didn't take that early step of applying in order to qualify for the exemption. So I know it's a little convoluted. We make people jump through some hoops. You know, it's helpful if you know where the hoops are, so you can steer people through them. Affordability, there's an affordability exemption available through the marketplace and one available directly on the tax return. It's important to understand what we mean by affordability in comparison to what we mean by affordability for your offer of employer-sponsored coverage, because the definitions are different and I know it's easy to get them confused. So we talked in I think the first webinar about affordability in terms of, you know, when can I bail on my employer-sponsored coverage and be eligible for APTC. That definition of affordability said that your offer of self-only coverage had to exceed 9.56% of your income. All of your Social Security was included in household income, and you were determined to be eligible based on the cost of employee-only coverage. So we're applying the family glitch in the realm of employer-sponsored coverage and whether it was affordable. But let's now switch gears and think about what happens on the exemption side. We have a very different definition of affordability. In this case, you may be eligible for exemption if your insurance, whether it's employer-sponsored coverage or your subsidized marketplace coverage, costs more than 8.05%. So there's a lower dollar threshold for the affordability exemption. We're also only including taxable Social Security. We're not including the non-tax Social Security. So that might also make a big impact for individuals. And for family members, for the purpose of exemption, we determine whether someone is eligible for exemption based on the actual family cost of coverage, not just based on the self-only cost of coverage. Still, for the employee, it would be based on self-only coverage because it, you know, that's the test for an employee. But for the rest of the family, we're looking at what is actually available to them. So let's look at some examples of this. Well, let's look at the rules first. So insurance is unaffordable if it costs more than 8.05% of household income. And that's the number, again, for 2018. For 2017, the affordability threshold is 8.16%. So how do we determine which kind of coverage to look at? If a person is eligible for employer-sponsored coverage, we're always going to look at the cost of that coverage. If the person is the employee, then we'll look at the lowest cost self-only plan that costs more than 8.05% of household income. If the person is a member of the employee's family, then we'll look at the lowest cost family plan and how much that costs. If the person's not eligible for any employer-sponsored insurance, then we can look at the lowest cost bronze plan, and we'll determine that after premium tax credits for all members of the taxpayer's family that don't have other exemptions, and determine if that if that is more than 8.05% of household income. So these are very, the calculations are a little complicated. It takes a couple of tax forms to and worksheets to do them. But these are the rules, and they are more flexible than the definition of affordability when it comes to becoming eligible for APTC with an offer of employer-sponsored coverage. So here's an example that kind of throws the rules together. Teresa, this is Teresa and her family. Teresa's employer offers ESI, which is employer-sponsored insurance, for herself and her children. She's still in her employer's open enrollment period, and she's visiting you to learn if the marketplace has better options. You talk to Teresa to determine her eligibility for marketplace coverage. You can see her income is almost $48,000, Teresa is the rare consumer who actually brings to you, without you asking, the cost of her employee-only premium and her employee plus children premium. Her employer doesn't offer spousal coverage, which is becoming a bit of a trend among employers. But you can see that the employee-only premium is 4.9% of income. The employee plus kids premium is 9.9% of income. So just based on knowing that, you would know that she's not going to be eligible for premium tax credits. The children are not eligible for, in this case, they're not eligible for Medicaid CHIP or premium tax credits. And Antonio is eligible, we think, for premium tax credits. But Teresa's frustrated because she doesn't want her family separated between all these different plans. And she just asked, well, why can't we all enroll together? What happens if we don't enroll at all? So what we would do on the tax side is we would go individually through each member of the family to determine, you know, what exemption, if any, would they be eligible for. So is Teresa eligible for an exemption? Well, for her, we would look at the lowest cost self-only employee plan. And because it only costs 4.9% of income, we would say the plan is affordable. She's not eligible for an exemption on the basis of affordability. For the kids, we would look at the cost of family coverage, and we wouldn't need to subtract out Teresa's cost or, you know, subtract out the $195 for self-only coverage. We just look at the whole cost of family of the employee plus children plan, and that lowest cost plan is 9.9% of income. And so since it's more than 8.05% of income, it is considered unaffordable, which means that the kids would qualify for an exemption. And it doesn't matter if the kids are eligible for other coverage, eligible for Medicaid or for CHIP. That's not taken into account when we're awarding this exemption. So you don't also have to do an eligibility determination for those programs. And then for dad, Antonio, since he has no offer, he's not offered coverage in his wife's, under his wife's employer. We would look at the affordability of the affordability in the marketplace for Antonio. So we'll look at the lowest cost bronze plan that would cover Antonio in the marketplace after accounting for premium tax credit. So you can imagine this is a lengthy worksheet in tax terms, but I'll cut out the math and tell you that the lowest cost bronze plan available to him is $2,000, which is 4% of household income. The plan is going to be considered affordable, so he's not eligible for exemptions. So that's the way each of the different affordability tests work. When it comes to getting an exemption, whether that exemption is granted by the marketplace or granted by the IRS, it works about the same way in each place. So it's helpful to know sort of what we mean when we say that insurance is not affordable. Another marketplace exemption is for hardship. As we talked about before, this is examples of pretty extreme personal hardships. but also includes some other things like utility shutoff notices. You know, unfortunately, many people have those. So there might be some other causes for exemption. Some of them are a little ill-defined. We don't have great clarity in what they mean, like high expenses caring for ill, disabled, aging relatives. I would expect that many people this year will be able to claim the hardship exemption on number 6, disaster that resulted in significant property damage. And obviously, as we discussed before, number 12, that someone was determined ineligible for Medicaid because the state did not expand coverage. And someone can apply for these exemptions for up to 3 years after the month of hardship. So there's not a lot of time sensitivity on these examples. If someone, you know, has, you know, maybe they complain that they've had to pay the penalty in the past and it really hurt because they had all of these other circumstances going on. Well, maybe there should have been a hardship there, in which case they could apply for a hardship that happened in the past and potentially refile their tax return to get that penalty back. Just a very brief example, Doug had a difficult winter after failing to pay his electric bill for 3 months. He received a notice in February that his electricity would be turned off. He scrambled to pay the bills but neglected other bills, including his insurance premium, and after 3 months of non-payment, his coverage was terminated retroactively. Doug can use the utility shutoff notice to apply for a hardship exemption for the time he went without coverage. The marketplace is going to determine the exact length of the exemption that they're going to grant him. But that's the kind of situation that someone might present to you in passing, and there is help there. You know, you can direct them, to fill out this hardship exemption form on their own time, and possibly get them in a better place. So, of course, with a really short open enrollment period, there's not a lot of time to do much of anything, but you can still direct people, especially people in particular circumstances, to the exemption forms when they might really benefit from them. So I think that the marketplace affordability exemption is really useful for people to try to utilize when household members are subject to the family glitch and that's preventing them from getting coverage. When someone has employer-sponsored insurance that is technically affordable according to the marketplace, so it's less than 9.56% of income, but it feels really unaffordable to them because there's this area between 8% and 9.5% where people could qualify for an exemption even though the insurance is technically affordable under the marketplace standard. You could also consider directing someone to this application if the insurance only appears affordable because they have all the Social Security benefits in there. Because Social Security benefits are counted differently for the affordability exemption, then they might be able to get an exemption. One area where I think the exemptions are particularly useful, I'll say it again, is when people are between jobs and they have difficulty predicting their annual income. Some people just have a real roadblock in being able to put an income down on paper because they are so uncertain that they don't even know how to start to estimate it, and feel very uncomfortable about the possibility of putting something down, getting coverage, and then having to pay back APTC. So if a person is in that kind of situation where right now they are between jobs, an exemption is one thing that you could direct them to at least make sure that they don't pay a penalty for that year. Also, the affordability exemption is good for a person who is over age 30 and wants to enroll in catastrophic coverage. They'll need an affordability exemption to do that. The Medicaid coverage gap exemption is useful when the person is in the coverage gap, especially if their income may change during the year, like the examples that we used where they appeared in the coverage gap at the beginning of the year, but by the end of the year they weren't. Well, to prevent that and preserve their ability to use that exemption, you need to lock it in. So, people can be directed to get that Medicaid determination, even if they know what it is. Get that determination so you lock in that exemption. So in general, you know, people sort of wonder, like, like, where do you even start with this list of exemptions? And as I said, at the time of application, all you really need to think about is about exemptions that might be forfeited if certain circumstances change, like we just talked about, the affordability exemption, Medicaid coverage gap exemption. People may be eligible for them when you see them and then not eligible by the time they file their taxes, so you can lock those in. Beyond that, we would look for any exemption that's available on the tax return, because you know those are so easy to claim. So people with income below the filing threshold, so people who are very low income, and then all of the other exemptions we mentioned before. And then finally, I think the hardship exemption is kind of the last place I would look, because the hardship exemptions, it's a little hard to nail down the length of the exemption, so there's a little less certainty there. So that's kind of last on my list. And we're going to just go briefly through the IRS exemptions. There's an exemption, this is the most common one, for people who have income below the filing threshold. So this captures a lot of people who fall into the Medicaid coverage gap, but who have, you know, very, very low incomes. You know, you can see that for a single person, the filing threshold is $10,400. So anyone with income below that amount for the year is going to be automatically exempt, whether or not they file a tax return. And for a married couple filing jointly, they'll be exempt if their income is below $20,800. So an example of this is Gloria. She works several odd jobs over the year and makes $12,000. She and her children remain uninsured all year. She wants to file a tax return in order to receive a tax refund from her withholding and to claim the earned income credit, but she doesn't want to pay a penalty for remaining uninsured for the year. So does she qualify for an exemption? Yes, she's going to qualify because her income is below the filing threshold. She's just going to check a box on her tax return to claim the exemption for the entire year for her family. And even if she doesn't file, she's going to be automatically exempt, so she doesn't need to file just to claim the exemption. The short coverage gap, a short coverage gap is less than 3 months, so really it's 1 or 2 months. If it's 3 months or longer, then none of the months in the gap qualify for the exemption. So you can't say, okay, well, I was uninsured January, February, March, I'll just apply the exemption for January, February. That's not going to work. There's also a look back across the year, so they're really trying to nail people down. Consecutive uninsured months at the end of 2016, for example, would count toward a gap at the start of 2017. So if you're uninsured December, January, February, that would be too long a gap to be to claim the short coverage gap exemption. A quick example of that: John is uninsured. He gets a new job in March. His employer-sponsored insurance begins in April. So John is not going to be eligible for this exemption because his gap was 3 months. It was not less than 3 full calendar months. But if he started his insurance coverage beginning March 15th, then that would be less than 3 full calendar months. He would only need that coverage, or he would only need that exemption for January and February. March would be considered a coverage month because he had coverage for at least 1 day of that month. The Medicaid coverage gap exemption, this is for individuals who resided at any time during 2017 in a state that did not expand Medicaid and had household income below 138% of the poverty line. So for our purposes, that is your definition of household income. It's the same as the one that's used in the eligibility determination, so that's the one you should be familiar with. And a person really just has to live in one of those listed states for any time during 2017, not for the whole year or more than half the year or any other sort of calculation, but really any time in those states. It's a very flexible calculation, and people can claim an exemption. So again, a quick example. Rashid was uninsured for all of 2017. His wife had insurance and their daughter had insurance. Their household income is $25,000, which is 124% of the poverty line. They live in Texas. Does Rashid qualify for an exemption? Yes, absolutely, because his household income is below 138% of the poverty line, and he lived in a non-expansion state, and those are the only qualifications he needs to meet. He can be qualified even if he had an offer of coverage through his wife's employer, for instance. Maybe there was an offer of coverage there, it was expensive. Maybe there was an offer of coverage there and he was just too lazy to enroll. Doesn't matter. He can still qualify for this exemption. Yeah, or if he was eligible for marketplace coverage, it doesn't matter. As long as his household income is below 138 and he's in a non-expansion state, he can qualify for this exemption. So what if they moved to Oregon, which is a Medicaid expansion state, midway through 2017? Hey, he can still qualify for the whole year because he lived in a non-expansion state at some point in the year, and he had income below 138%. So he would still be eligible for the exemption. There is an exemption for citizens living abroad and certain non-citizens. So this includes a whole bunch of categories of U.S. citizens, nationals, and non-citizens. It includes people living inside the United States and outside the United States. It's a very broad exemption, with a lot of different little categories in there. So you've got to do a little work to figure out who qualifies for this exemption, because there are so many different ways to qualify for it. But importantly, for our purposes, it includes people who are undocumented immigrants. It also includes non-residents, people who file a 1040 NR. So for instance, if we have Fatima, who is a DACA grantee or dreamer, she and her husband, or her husband and daughter rather, are U.S. citizens. Fatima can use exemption code C and claim it for the full year. We already talked about the unaffordable, insurance is unaffordable exemption. If we're looking backwards to the 2017 coverage year, we'd be looking at the lowest, we'd be looking at an affordability threshold of 8.16% of household income. So insurance would be unaffordable if it costs more than that amount. Again, we first look at whether someone had an offer of employer-sponsored coverage, and if they did, were they an employer or were they a member of the employee's, were they an employee or a member of the employee's family? And then if neither of those, and a person had no offer of employer-sponsored coverage, then we would look at the lowest cost bronze plan, and whether that costs more than 8.16% of household income. There is one special rule related to aggregating the cost of self-only coverage. So if you have an aggregate cost, so if two people in the family have separate offers of employer-sponsored coverage for themselves, and there's no affordable family offer, then we would look at whether the combined cost of the offers of self-only coverage is more than 8.16% of income. So it ends up being a lot of math to figure this out, but it's basically people whose insurance looks affordable on paper, but if they were to both enroll in it, it would be really unaffordable for them as a family. So this is the example. Jay and Priya each have offers of self-only employer-sponsored coverage. There's no offer of affordable family coverage. For Jay, the cost is $2,400 a year. For Priya, it is $2,100 a year. the aggregate cost is $4,500 a year. So we can look at the aggregate cost of insurance compared to their household income and find that it's unaffordable because it is more than 8.16% of income. There are also exemptions for people who are incarcerated or people who are members of an Indian tribe. Some of these exemptions used to be available via the marketplace, and now they're only available via the tax return. And here's a list of resources because we know that this is a ton of information. There is a penalty calculator from the Taxpayer Advocate Service, which is an independent part of the Internal Revenue Service. The calculator itself is it's a little complicated to use, but once you figure it out, I'd play with it a little before you try to use it with clients. And then here's a link to all of the different exemption forms. There is also healthcare.gov has gathered up information on tax forms and tools. And for some of the information that you need for the affordability exemption, like the cost of a benchmark plan, the cost of the lowest cost bronze plan, all of that will be available at healthcare.gov/tax-tool. They haven't updated it for 2017 yet, but I'm sure that come January they'll have it updated. And with that, Hallie, we can take some questions.
Perfect. Thank you for that. And we have a lot of really good questions. Let's see. So first, I know that this is really confusing because we switch back and forth between 2017 and 2018. But could you just review when you would use that 8.16% number for the affordability exemption and when you would use the 8.05% test?
Right, so 8.16 would be the number that you use for people who come to you and they say, I didn't have insurance in 2017, I've been uninsured. And if you're trying to help them figure out if they would be eligible for an exemption. Now that's not going to be, since you can't do anything to affect change there, that's not going to be an open enrollment activity. But you know, many of you work outside of open enrollment, so that's when you would use 8.16 for people who were uninsured during 2017. For people who are maybe they're wavering on whether they want to enroll in coverage for 2018, and you're talking about the exemptions available, the number that you would use there is 8.05% for 2018.
Perfect. And sort of relatedly, can any of these exemptions be applied retroactively? So if the marketplace exemption, so you're obtaining an exemption for 2017 in 2018.
Yes, so if we're talking about marketplace exemptions, the retroactive exemptions would be like hardship exemptions can be like someone can apply for a hardship exemption in 2018 for months during 2017 or 2016 or 2015. So you can look backwards for the hardship exemption. The affordability exemption in the marketplace is only forward-looking. That's another reason that you sort of have to lock it in at the beginning of the year, because the marketplace exemption for affordability is only granted for forward months, for future months. So if you were to apply for it at a later date, it would only be for part of the year, and there are limitations on when you can apply for it. So you really want to try to get an application in for a marketplace affordability exemption prior to the start of the year, so it covers the whole year. Now the IRS exemptions, they are all looking backwards, and there are pluses and minuses of that. You know, the plus is that it's flexible, so you don't have to try to do income projections and everything. You're using your actual income to do some of these calculations. But that's the negative too, is that you're using your actual income to do some of these calculations. And so people, as some of the examples showed, people who believed that they would be eligible for an exemption might find out based on their actual income from the IRS that they aren't eligible. And at that point, there's really not much you can do about it.
Perfect. And you mentioned about how for the affordability exemption for the marketplace, that it is forward-looking. So if you wanted it to cover the whole year, you would need to do it before the beginning of next year. But relatedly, because of the shortened open enrollment, is it reasonable for people who may fall into the coverage gap to ask them to come back after the end of open enrollment, after December 15th, to complete the exemption application?
Yes, if they're actually going to come back. I mean, because remember, many people don't, and so it might be a case where, um, we've heard some assisters talk about, sort of strategize about how to deal with this. Like, is there someone, maybe someone who is just terrified to talk to people about plan selection, who can help people through an application to determine that they're in the coverage gap. So think about how to use staff and volunteers who may be sort of undertrained on some of the aspects of enrollment, but who are adequately trained to talk to someone about income and to click through the screens. Maybe there's a way to help that person while they're still there, because many people just aren't going to come back. They're going to hear they're eligible they're eligible to get out of the penalty, and they're going to go away. And if they turn out not to be eligible at the end of the year, they're going to be unhappy, to say the least.
Yeah. Um, and let's see, going back, so for the if someone falls into the coverage gap, or if they were in the coverage gap for part of the year, so let's say a person lives in a non-expansion state, um, can they claim code G on their tax return for the months when they had no or low income, say January through April, even if their final income at the end of the year is more than 138% of the poverty line?
No, not unless they had that certification from the marketplace that they were in the coverage gap earlier, like when that was true. So that's why we can't just, even though there is an exemption on the tax return for people who are in the coverage gap, we can't just wave off everyone and tell them just claim that exemption on the tax return, don't worry about it. For some people whose income is going to increase at some later date, um, they really need to lock that exemption in early by applying for coverage, getting denied, and having that denial, which should include the code that they can use on their tax return in most cases.
And then let's do one more question. Can people apply for an exemption, the marketplace exemption, online, or do they have to do that through a paper application?
Oh, they're going to have to do it through a paper application. Yeah, it's
Perfect.
it's it's unfortunate,
Yeah.
and it's a lengthy application. Bring some popcorn. It's going to be a while, especially the affordability application. So these things are no picnic. People will have to take them home and do them. Possibly, it's really because it's basically for the affordability exemption application. It's essentially everything that you would cover in healthcare.gov up to plan selection. Um, so it is quite complicated for some people with complicated family situations. So and it is going to be done on paper.
Excellent. And one last question. I lied. So for the short-term coverage gap, um, so say someone had coverage until January 10th, and then they had a gap until April 20th. That sort of is would seem like more than 3 months, but the exemption would only be needed for February and March. So do they qualify for that uh, short-term exemption?
Yes, they do. So you're considered covered for the month if you're covered for one day of the month. You don't need to be covered the whole month. You don't need to be covered half the month. Just one day, any day in the month is going to be considered covered for that month. And so in your example with someone who had a gap between January 10th and April 20th, January is considered covered, April is considered covered. They only need an exemption for February and March, and they would get that through the short coverage gap.
And with that, we're going to bring the webinar to a close. Thank you so much for joining us today, and we hope to see you next week. Thank you so much.